When I first started my nursing career, and it was before OBRA, before there were any regulations for the training of CNAs. And my very first clinical was in a nursing home, and the conditions were deplorable. I mean, bed sores that you could put your fist in were just common. All of the patients were catheterized. Nobody was given a real bath if they were bedbound, and it was just so sad, and no wonder no one ever wanted to be in a nursing home. But since OBRA came around and started mandating, you've got to train people to take care of our residents in our nursing homes, I've seen a huge improvement in the care that has been given. I worked in Florida and taught nursing assisting, and the nursing home that our students did their training at was an older facility. So, it wasn't new and beautiful and bright and everything. But what really stood out was the care that the CNAs that worked there gave those residents, and that the residents were happy. And to have my students get to learn in that type of environment was just really enlightening as far as how far it had come since there was no training. Since that time, I'm seeing the role of a CNA expand greatly. Many of our CNAs work in hospitals, they work in acute care settings, they work in rehabilitation centers, they work in specialty areas. My own daughter, for instance, was a CNA at a pediatric hospital and cared for small children as a specialty. So that is a greatly expanded role of the CNA that we have seen come. They're now being trained in areas, labor and delivery. A lot of places train CNAs to scrub C-sections. They certainly care for the mothers postpartum. As we look into the hospitals, I've had CNAs actually take care of me where they discontinued my IV line and things that before only nurses had been allowed to do. Then the pandemic. That kind of turned the whole world of healthcare upside down. Um, our little residents in the nursing homes experienced a lot of loneliness and abandonment, actually, because their families couldn't come see them anymore. Um, a lot of times the nurses were even afraid to spend time with them, afraid either they would give someone COVID or catch COVID themselves. And so the role of the CNA as a companion and as that humanistic factor in caring for these residents during that time where they felt so vulnerable and so lonely, it really stepped up their role coming in to the practice. What I see for the future, I think CNA is going to expand as our population expands. More people are getting older and living longer now. Medicine has advanced to the place where, things that would have killed us early in our lives, 50 years ago, now we're living with and living healthy with well into, later age. And so the population's older. And when we do need the care of healthcare, if we do have to go to a nursing home or assisted living or a rehabilitation center, we're older than and sicker than we've ever been. And so the comorbid problems that the residents have, the medical conditions, all of those make the CNA have to be more acutely trained to care for that. And I see that continuing in the future.